And the Executive Director of Health and Community Education at the Piedmont Healthcare Corporation. So a lot to take in with this study. Thank you for being here. What do we know about why this is particularly impacting women compared to men?
You know, when we look at women, we're starting to really have some focus on the biology and physiology of women's bodies being different. And this is why there's really a push, not only within the scientific world, but in Congress as well, to start to have better funding for women in clinical trials. When we talk about women, generally when we talk about research, we talk about just reproduction. You know, it's all relegated to breast and uterus and ovaries, but women actually interact with the environment in a number of ways, including estrogen. Estrogen receptors are not only found in the reproductive system, they're in the heart, they're in the brain, they're in the lungs. And so as you go through midlife and these estrogen levels decrease, what are the impacts physiologically and pathophysiologically on a woman's body? And then how is she interacting with the environment? And then that relegation to mental stress and mental health.
And the part of the study that we read that stood out to me was that women who were self-silenced during marital conflict were 4 times as likely to die during the 10-year study period compared to women who always spoke their mind.
Right.
What does that tell us? I mean, what do you take away from hearing that?
So what we talk about is anxiety and depression. And we look at the mental health of women who self-report anxiety and depression. Those who are followed over a 10-year period of time have a higher degree of developing high blood pressure, high cholesterol, and diabetes in comparison to women who are not reporting those levels of mental stress. In fact, it actually puts younger women on par with the risk of heart disease of men. Generally, because of the protection of estrogen, younger women especially enjoy a decreased risk of heart disease compared to men until you reach perimenopause and menopause. Now, younger women with higher levels of mental stress actually also come on par with men. And it's very alarming because the heart symptoms of a woman may be different from those of a man. So not only now is this mental stress increasing her risk, she may not even recognize her symptoms of heart disease.
Because for so long, the focus when you think of heart disease, and it is a very important issue with men, but it seems like the conversation is always geared towards men when we talk about heart health and heart disease.
You know, so important, and it really is, and that's why the conversation has to shift, and that's why it's important for us to get funding for clinical trials, for these companies and big medical facilities to begin to enroll and recruit more and more women into these clinical trials such that we can really make certain that every device and compound and drug that's approved by the FDA is relevant to these populations, and we're not simply extrapolating data from men, applying it to women as if women are small men, and then we're not really certain if we're comparing apples to apples or whether it's apples to oranges.
What are some of the symptoms that women should be looking out for?
So when we talk about symptoms, the main symptom is no symptom. That's the dangerous one. So hypertension is a silent killer because it doesn't have symptoms, but it does increase your risk of heart disease. High cholesterol, another silent killer, increases your risk of heart disease. Symptoms of a heart attack, though, of a woman may be different. You may have fatigue, chronic fatigue. You may have jaw pain. You may have some back pain. You may have pain actually in either arm, not just the left arm. So these are symptoms that can sometimes be confusing. That's not the crushing chest pain, the shortness of breath. You break out in a cold sweat. These are symptoms that are much more subtle, but actually may be more common than we think, especially taking into account that women are actually the majority of the population. And so if women are having these symptoms, these actually might be the more common symptoms with regard to presentation.
And when it comes to treatment, how could anxiety and depression treatment that's out there impact heart health as well?
And that's an answer that we don't know.
Okay.
So directly treating mental health disorders, does that then dial back your risk for heart disease? What we do know is the result of hypertension, cholesterol, and diabetes. If you can treat those as well, then you are able to decrease the negative impact on heart disease. So if you develop high blood pressure, it needs to be treated. If you develop diabetes, it needs to be treated. If you develop cholesterol, it needs to be treated. Now, if you develop mental health, anxiety, and depression, and you take antidepressants or other mental health drugs for that, for whatever your support is for anxiety or depression, it's unclear whether direct treatment for mental health disorders actually can improve your heart risk.
And I think of a lot of women, they deal with a lot of stress. You have family, school, issues of body image, which we often talk about, finances as well, as everybody does. What is the number one thing that people can do right now when it comes to managing that stress when it can feel so overwhelming?
You know, one of the things that we see, you know, you mentioned in that study, women who self-silence in marital conflict. Oftentimes what we see is people sort of self-abuse. They eat more.
Yeah.
They don't exercise as much. They may drink more. They may smoke more. They may turn to substance abuse. And so all of these types of sort of self-destructive behaviors also increase the risk. And so you want to be cautious and cognizant of whether or not you're taking sort of an extra drink, or whether you're whether you're starting to smoke cigarettes, and whether you seem to be more and more of a couch potato as you become more and more depressed. So all of those are things that you want to be aware of. And once you're aware of them, social support is so important, making certain you're a part of a social group. And then absolutely reach out to your physician or mental health provider or mental health resource for support. There's no shame in there. There's no stigma. If you need support for mental health or even marital conflict resolution, make certain you reach out for that, because your mental health is connected to your heart health. We want everybody to stay healthy, and most importantly, to also stay alive.
Yeah, that is such an important message. Dr. Jane Morgan, thank you for taking the time to be with us. It's always great to have you on and to get your perspective on this.
Thank you.